Hello and welcome. Welcome to Kidney Conversations with ReMend. This is a webinar designed for patients by patients and where we have open, honest discussions about kidney care. I am Kiku Boyance, Executive Director for ReMend. We're a nonprofit organization dedicated to empowering people with kidney disease. We're a group of everyday people who have experienced chronic kidney disease, dialysis, or have received a transplant. ReMend provides peer-to-peer mentorship, guidance, and emotional support, and our goal is to encourage and empower those people who are on their kidney journey. Our website is a great place to learn more about what we do and the different ways you can help us help others on their kidney journey. Please visit remend.org. This month's topic is plant-based diets and the kidney patient. When you have kidney disease, knowing what you can and cannot eat is a critical aspect of treating your illness. I'm a huge foodie and I'm also a kidney patient, and this type of information wasn't so readily accessible when I was diagnosed with CKD almost 20 years ago. So this topic is fascinating. Plant-based diets, it's more than a few buzzwords, it's a lifestyle and a booming business. In fact, a study by Plant-Based Foods Association shows U.S. retail sales of plant-based foods continue to increase, growing 6.2% in 2021 over a record year of growth in 2020, and bringing the total plant-based market value to an all-time high of $7.4 billion. So what is a plant-based diet? Is it expensive? Is it beneficial for kidney patients? We'll cover these questions and so much more. But first, we have a little housekeeping. Before we dive into this exciting topic, I have a few things to discuss. We want to hear from you. So please use the chat box to send us your questions. We'll answer questions as they come in, and if we miss any, we'll try to answer them at the end of the discussion. We also have a brief survey that you can complete anonymously, which we would very much appreciate. So let's get on here to our panelists. We have a wonderful group here today. I mean, this is such a hot topic, and we have some fantastic people to discuss it with. First, we have Amy Harshman. She is a renal dietitian at the Kidney Nutrition Institute. Celeste Painley, I messed it up, renal dietitian with Plum Nutritious Kidney Diet. Charmaine Griffith, ReMend Mentor. Jason Martini, he's the executive chef for Mama's Kitchen here in San Diego. Jessiana Seville, renal dietitian, founder and CEO of Kidney Nutrition Institute. Lexi Stryler, registered dietitian with Mama's Kitchen. And Michael Kenyon Rosenberg, the newest ReMend mentor. We're welcoming him to the family. Okay, so let's see if I can make sure everyone shows up on this screen. I didn't say it. I was going to share my screen. Let's see all of your beautiful faces, kids. Hi. Thank you all.
Hi, everybody.
Hello.
Hey, guys.
So I want to just go around the room here and ask you a few questions so people get to know you a little bit. Celeste. Oh, I would pick Celeste, and she doesn't have her.
Hey.
Hey, Celeste.
Hey.
Hey, do you want to turn on your camera? I can't see you.
I'm trying, and it says the host has your camera disabled.
Oh my goodness. Shame on me. Well, let's Charmaine, how about you? Let us talk about your kidney journey, and when you were on your kidney journey, did you ever consider a plant-based diet while I fix Celeste's camera?
Yeah, so I've transplanted twice. My last transplant was both transplants are from cadavers. My last one was July 4th of 2003, so just celebrated 19 years. I was an in-center hemodialysis and peritoneal dialysis patient. I definitely preferred peritoneal just because it was a little bit more lenient with diet and fluid and all that stuff, and it gave me a lot of flexibility. As far as diet goes, I always struggled with my diet. During my kidney journey, still kind of struggle with my diet, to be honest. But I never really got into thinking about a plant-based diet until even later in life, many years after my transplant, probably a good 12 years or so after my transplant, that I even start looking at plant-based. So I did do a plant-based diet for a short bit. But anyway, but no. So to answer your question,
Okay.
no, I never did. And so I'm very excited about this webinar because just learning about, the different options to help our mentees and things like that.
Awesome. Thank you.
Yeah,
Hey,
you're welcome.
Celeste, sorry about that. Tell us about what
I'm
you
in.
do. Tell us what you do and your experience with kidney patients.
Sure, thank you. It's good to be here. So I was a DaVita dietitian, working with peritoneal and hemodialysis patients, as well as I was a Kidney Smart educator, which I had the pleasure of working with CKD patients for many years. So total of over 15 years in all those functions, and actually did quite a bit of plant-based renal diet counseling in the process. So I'm excited to talk about it.
Awesome. Thank you so much for being here. Excuse me. Jessiana, how about you? Please share the details of how you founded the Kidney Nutrition Institute and your mission.
Cliff Notes version. We'll make it really short. Worked in dialysis for a long time. Actually, even like before end of school, I think like the kidney world called my name. And after a while, I just wanted to be on the other side of the kidney world. I wanted to be able to help less people end up on dialysis. And that's really where it started. And it actually started originally with a blog called Kidney Grub, which I still love that name, and sometimes wish I could go back to just food blogging. It's a little bit easier than what I do now. But that's where it kind of started, and then it just kind of takes off after a while. It's been a great journey. A lot of amazing people.
I'm looking forward to hearing a little bit more about what you do. So thank you for that. Chef Martini, Chef Jason Martini, how are you doing today? Thank you for being here.
Good. How are you?
Good. Please share how Mama's Kitchen was motivated to start the chronic kidney disease pilot nutrition program.
Fascinating. This pilot program was pretty organic for us. So for those of you who don't know, Mama's Kitchen is a little more than 30 years old, and was mainly for most of that history servicing the HIV and AIDS community. It was 2018, I believe, when we started looking at medically tailoring meals and looking at other things. So cancer and heart disease came to mind first. But where CKD kind of got into the evolution is that we started working with diabetes clients, and a lot of the diabetes clients were going through dialysis. So it's actually the referring partners that started to bring to our attention that there was a need for clients to be not only receiving our food, but also the wonderful nutritional education that Lexi and our other two dietitians provide.
Yeah, thank you. And Lexi, how did you become involved with Mama's Kitchen? And I actually want to talk to both of you. I wanted to hear your approach to meal planning for the CKD program, but I do also want to mention, because I know we had a discussion about, Mama's Kitchen isn't a plant-based organization, but I feel that it was important to share information about Mama's Kitchen. I just love the organization so much. I've been a supporter for many years. And I love the CKD program. I'm hoping that you can share more about that. And I just want to know people have an option out there. So Lexi, let us know how you guys do your planning and how you became a part of it.
Yeah, I would love to. So I actually learned about Mama's Kitchen when I was interning a few years back at a program called Community Servings. It's a similar program, but over in Boston, and they fall under the same Food as Medicine coalition as Mama's Kitchen. So when I moved to San Diego, it was just the perfect fit. I already was very passionate about the mission. And as far as the planning goes for the chronic kidney disease program, of course, we work alongside Chef Jason and the other dietitians. We have basically, we serve chronic kidney disease clients who have stages 3, 4, or stage 5 on dialysis. So we have a couple modifications for our kidney clients. We can do a full renal diet, which is low potassium and low phosphorus, or we could do just a low potassium for clients who are not on dialysis and may not need to limit phosphorus yet. So that's our main modifications for the kidney clients. And overall, all of our meals are heart healthy, low in sodium, which is appropriate for the kidneys as well.
Awesome. We're going to talk about that and a little bit later how people can also be a part of your organization. So thank you for that, Lexi. And Miss Amy, thanks for being here with us. Can you tell us a little bit about your experience and philosophy? I know that you're also certified mind and body nutritionist and as well as a renal dietitian, but I'd also love to know what your involvement is with Kidney Nutrition Institute.
Yeah, thanks, Kiku.
I just kind of similar as to Jessiana and Celeste, just after being in the renal world where a lot of us dietitians start in dialysis. For me, it was kind of a pain point because I had this inability to help my patients really at the point that they were at in dialysis. There wasn't a lot of hope for them or positivity. I mean, yes, transplant was discussed routinely, but I just wanted to be able to help more.
Mm-hmm.
And it frustrated me that I couldn't do more for them. And so I just felt this call to serve the CKD community, and then stars aligned and I met Jessiana and just fell in love with just what her organization is about, how she wants to serve and care for the people that come under her organization, and have just loved it. As far as the mind-body nutrition piece, that has been a nice asset for me as I work with my clients. As we know, food is very much a psychological experience too. It is not just a physiological, I eat it, it nourishes me. And so those components come into play a lot with any chronic condition, especially with kidney disease, right? I mean, there's a lot of emotions around food, lifestyle changes. It can be fearful, it can be overwhelming. And so helping our clients kind of understand and navigate that, and that those feelings are totally normal, is really powerful. And I really appreciate having a place to be able to do that at Kidney Nutrition Institute.
Awesome. Thank you. Thank you all for being here. And one more, Michael Kenyon Rosenberg.
Here I am.
He's our newest ReMend mentor, as I mentioned. Could you tell us a little bit about your kidney journey and how being on a plant-based diet has really changed your life?
Absolutely. Well, thanks for giving away the spoilers that I am a plant-based eater. I started dialysis back in 2015 in August. And I chose peritoneal dialysis PD because one of the reasons was the freedom of the diet. I didn't want all the diet restrictions that went along with HD hemodialysis. And so it was like, cool, I can eat pretty well. And then imagine my surprise when 8 months later, I had a stroke. That's right. It was a stroke, not a mini stroke or a TIA, transient ischemic attack, as it's sometimes called. It was a full stroke. And I was like, what the heck? And it was then in the hospital. It was actually the first time I had ever heard anybody in a hospital setting mention a plant-based diet. I had played around with a vegan diet prior to that. But first of all, having gone through a stroke, dialysis was fine. I could manage dialysis. Having a stroke was the most traumatic event that's ever happened to me. And I was like, I'm going in for plant-based diet. However, I did work very closely with my renal dietitian to make sure that my potassium wasn't too high, my phosphorus didn't go too high, and make sure I was getting enough protein. Guess what happened? I did get enough protein. I did manage my phosphorus and potassium. It took me a while to completely cut out all meat. I started out just cutting out dairy and eggs, and I would eat chicken and fish, like the leaner proteins. But then eventually I cut them out. Like I started off with meatless Mondays, and then we eventually cut like a day out every month or so after I had my labs, and my labs were fine. I would say I'm cutting out another meat. Eventually went completely meat-free, completely dairy-free, and I have not looked back. I don't necessarily now focus too much to like, oh, does this have any fish products in it? I'm not going to eat that. I'll eat some things with fish products. I take pills, like, vitamin D's a lot of times have some fish products in them. So I wouldn't call myself vegan necessarily, but I definitely eat plant-based.
Well,
And it's
that's
helped me.
one thing. I think that's one thing we're going to discuss too, is the difference between being vegan and plant-based. And I'm hoping our lovely panelists will be able to get into that a little bit. So I thank you, Michael.
Yeah.
I want to jump in and just with the biggest misconception. What is the biggest misconception about a plant-based diet? Jessiana, can you share what your thoughts on that?
Yeah, sure. I'd love to. And I'm going to address specifically to the kidney community the biggest misconception about a plant-based diet. So, and it depends a little bit where you're talking about, right? CKD and dialysis, they tend to be different worlds, and honestly, they're really different diets. So if you talk about dialysis, the number one most common misperception is that it doesn't have enough protein, because everyone's all about protein and that sort of thing. In dialysis, that's the number one biggest misconception there, hands down. That would be the number one reason a doctor like, oh, no, they can't go plant-based because they won't get enough protein, which is crazy. It's ludicrous. But in the CKD world, the misconceptions are, there's not so much misconceptions, there's just confusion, because people get online, and if you just Google like renal diet and top 10 things that come up on Google, it's like Healthline, and they're like, hey, don't eat potatoes, don't eat bananas, don't eat nuts, don't eat, like, the very antiquated version of a renal diet is what comes up. And they're like, whoa, I want to go plant-based, but I can't have nuts and beans. So I guess I can't go plant-based unless I just eat like lettuce and fruit all the time. And so that's really, it's less, I mean, a lot of people want to move to plant-based, but they're just not sure what information is right. And so it's hard for them to take that step until they get that clarity that, hey, like, did you know the most recent guidelines are that potassium isn't the biggest deal anymore? Like, oh, guess what? It's not late to diet as much as everyone thought. So we don't have to do that, or phosphorus or whatever. So it's exciting to see that slowly that is turning over, and people are getting clarity that a renal diet is not about these old, antiquated, don't have lists anymore.
Yeah. And with ReMend, I hear so many times when I'm speaking to our mentees, oh, the renal diet sucks. And I'm like, well, I thought that back in the day. In fact, I didn't even really think about it. I said 20 years, but it's been more like 25 years. And I'm showing my age, unfortunately, but there's so much more information out there now than there was previously. And so I'm excited you guys are here to talk about that. And one of the things I also wanted to talk about, you brought up kind of like the difference between, well, each patient is going to be different, but a CKD diet versus a dialysis or end-stage renal disease diet is completely different. So Lexi and Chef Jason, I wondered how you guys are able to move forward with that with CKD. How do you guys manage that with your meal planning?
Yeah, so with our meal planning, kind of what Jasenia said is we don't have, certain foods that we avoid in any way. So sometimes clients will come onto our program and be a little confused if they see some tomatoes or they see a little bit of potato or some beans in our meals. And the point of our program is to show clients that they can still incorporate these meals or these foods that are notoriously known as being high potassium, high phosphorus, but just show them, more appropriate portion sizes. So that's really what we strive for at Mama's Kitchen, is to show them how medically tailored meals can still be flexible.
Okay. And Chef Jason, what are the specific nutrient concerns for people on dialysis, and how do you focus on that with through Mama's Kitchen?
Right. I mean, everything runs through our dietitians as far as that's concerned. But for me, for example, what we did today in the kitchen, we made a wonderful egg frittata, fresh from scratch for everybody. It does come with a large portion of roasted potatoes for the average client. So what we do is we sub that out in that case with like a fresh made rice pilaf. So they're still going to get the beautiful egg frittata, they're going to get the rice pilaf, and they're going to get fresh oven roasted vegetables. So all that is going to go through our 3 dietitians, especially Lexi, who tends to take the lead on the renal program. and they're just going to mainly flag things that I'm trying to work with and say, ooh, okay, this looks a little high. Can we change this? You know,
Okay.
so that's how we're operating, and we're
Okay.
not avoiding foods necessarily, and we're still providing tons of ethnic selections, different foods. Our clients eat 365 days a year, so there's a lot of menu
Wow.
options.
That's awesome. Thank
Quick question. Do you guys have transplant patrons, I guess what you call it, restaurant patrons? Do you guys have transplant patrons as well? And how do you tailor the diet for them?
So for the eligibility for the program, clients would need to have stages 3, 4, or have stage 5 starting dialysis within the past year. We had to kind of just draw the line with that eligibility. So we've had a couple clients who have had kidney transplants, but that's not like a main criteria that we focus on.
Thank you. Hey, Amy, I wanted to ask you, how can plant-based foods be added to a kidney diet while maintaining the appropriate intake of the nutrients that we've kind of mentioned, phosphorus, potassium, and sodium?
So how those are incorporated, I think really depends on, touting the little horn for the dietitians here, the renal dietitians, you know, that you really need someone to guide you along. And like Lexi mentioned, it's less about restriction and more about putting food back on the plate.
Mhm.
What can you have? How much can you have? Empowering them to understand portions, right? You can't eat a whole avocado and then have a banana and tomato sauce or tomatoes from your garden all in the same day. You know, it's not about, we don't hand people lists, say, avoid this, yes, this, no, this. I mean, that's not empowering people. But I really do think that working with a dietitian to help you look at your labs, look at your trends, talk to your doctor. Are there concerns with fluid? Are there concerns with potassium and phosphorus? Do we need to watch that if we switch to a plant-based diet? Do we need to be more concerned about that? More often than not, we do use the plant-based diet. I don't know, Jess, what would you percentage wise, like 90%? Yeah, I mean, like a sliver of people that we don't. But they, more often than not, like their labs are beautiful. I mean, truly, less additives, less phosphates. I mean, all that stuff that's in the packaged foods, and you're eating more real foods. Yes, it needs to be tailored, but the point being, it's not going to be as scary to switch to a plant-based diet from how your labs are going to look in our perspective.
See, I don't think patients look at that, and Michael and Charmaine, chime in if you'd like, but when I was diagnosed, I did receive a list. Avoid these foods. And I hung it on my refrigerator, but you know, I didn't really.
I had all the little pictures, you know.
Yeah,
like
and they weren't like real pictures. They
no,
were
they were like
drawings.
drawn. Yeah, like this is like how much you can eat of this, you know, and
Right.
then like a little circle, or like, I don't know, yeah.
But
yeah,
no, that's
just,
great that you guys are doing that work.
Well, yeah, and for me, like a lot of my dietitians, so I've seen, I think 3 or 4 dietitians the whole time I was doing dialysis. I've got a transplant now, so I'm free and clear from the transplant diet, from the dialysis diet and stuff. But I'm still doing plant-based. But I did have a dietitian who told me that plant-based, she thought she actually read some research or something, that plant-based foods do not absorb like potassium and phosphorus the same way as other foods, but I would like to put that out to the dietitians and hear what they have to say about that.
So
That's true. Yeah.
Jessiana?
I didn't know if you were going to keep going, Celeste.
Oh, sorry, Celeste.
Oh, that's okay. From the research that I've seen, it's about 40 to 60% in the plant-based food items versus, say, a processed food like Coca-Cola or Cheetos or something that's heavily processed, that has all the additives, the processed cheese. So if you're getting a food that's like farm to table, you know, grown in the garden, or you know, just grown on the farm and nothing's been done to it, a plant-based food, beans or, any kind of vegetables and fruits in their natural form. They're not going to, and nuts, they're not going to be as absorbed. They're not going to be 100% absorbed in your body because of all the fibers and the phytonutrients and the breakdown in the body. They're only absorbed at up to about 60%.
And so what does
Yum.
that mean to the kidney patient in layman's terms?
Well, that you can basically have a lot more of those foods without going over your limits that are going to cause your blood test results to be higher than the normal range.
Mm-hmm.
Kiku,
So-
to add on to this, like as like a reality check, people think that it's the fruits and vegetables and the plants that are like high in potassium or high in phosphorus. But guess what? Meat is super high in potassium and phosphorus. No one ever tells you that. And so when you switch to plant-based diet, you're not upping your like nutrients of potassium and phosphorus. And honestly, for a lot of people, if they got a little bit more potassium, especially with CKD, it'd be great. It'd be amazing. It'd help their blood pressure. But you don't necessarily up those nutrients. You just change them for something different. Like if you compare like portion for portion, like black beans and like chicken, they're pretty darn close to the same, not exact, but they're pretty close. And on top of that, like Celeste was saying, the fiber in those plant-based foods, you can't absorb as much of the phosphorus because it's all bound up in what are called the phytates or the fiber. And so actually you would get less phosphorus. And you do see with some patients, they switch to plant-based diet on dialysis or CKD, and all their numbers actually improve. It's not like you're like, I think sometimes the perception is you're gonna like tread this line. You gotta be super careful because you might teeter over the edge because you're doing this radical plant-based diet. That is a huge fallacy because it's just like straight up not true. If you do a nutrient comparison, it is when you switch it, you get more fiber, more nutrient density, and actually foods that probably aren't that much higher in potassium and phosphorus, if that's what you're worried about.
Thank you.
Correct.
Thank you for that.
Well, so after my transplant, then my phosphorus was low, and I'm like, man. And so they're like, you got to eat more. I was like, I have to eat more nuts and beans. I guess so. Okay, more avocado. Yum. All right, sounds good to me.
Yeah, I found that that it was, you know, because I was on peritoneal dialysis as well, and you know, as I mentioned, one of the benefits or reasons why I went on to peritoneal was less restrictive. So I was very active when I was, well, at least trying to remain active when I was on dialysis, and so it actually allowed me to give my body more of what it needed, just because there was less restrictions because I was dialyzing every day. And so when I made that transition over to transplant, I was super excited, but at the same time, it was a little bit of an adjustment to be able to eat just anything that I really wanted. So I love the fact that the education is now more focused on portions and just that we can get the nutrients and things that we need and have more food, right? Because I think that would help the transition as well. So.
And you know, Charmaine, like as well as that, the other shift beyond just portions is personalized. Like honestly, if you go to a professional, like, well, let me tell you the renal diet. That's like old news, like super old news now. But we teach a class that in our class will be like, hey, what is the best diet for renal disease? Like, what is the renal diet that is best? And the answer is, it's like a fallacy. There is no such thing actually as a renal diet. It's just about a diet for you because every person is totally different. And there's not one thing that every single person has to do.
Okay. We actually have a question from Walt. And he says, I understand
Walt
red
Rosenberg, by the way, who I believe is my father. So
I was just
go
gonna
ahead,
say.
go ahead, Charmaine.
Okay. Would you like to read the question? Okay, I'll just read it.
You go ahead.
It says, he says, I understand red meats and fish should be avoided due to high levels of creatine. I've been drinking a plant-based protein fruit smoothie using cashew milk. Does plant-based protein mixes have low levels of creatine, or should they be avoided due to the protein?
Who would
Whoever
like
would like to grab that one. Just open that up.
Celeste?
So
Oh, Jessiana.
I just talked, so it was like I'm waiting for someone else to pop in. As there's like actually a couple questions in there. Like it's not just one question. So is a plant-based protein powder too much protein? You know, it depends on you and what else you're eating in that day. So I can't say yes or no. Is a plant-based protein higher or lower in creatine in particular? I know for us, we don't look at that particular like item when we're comparing protein items. Like we really keep it pretty simple. Is it plant-based or is it not plant-based? We use some fish in some of our regimens. We steer away from red meat quite a bit, but it's like there's different questions there.
Well, I want to jump on something that you just mentioned about proteins. I wanted to ask Chef Jason, what kind of proteins does Mama's Kitchen use for their CKD program?
As of now, we're pretty traditional. So we're serving a lot of chicken, turkey, flexi, anything, chicken, turkey. We do a little bit of red meat.
Yeah, not too much. Eggs.
A lot of eggs.
And they also get some like small portions of beans, and they'll get cheese sticks, so some dairy too.
Yeah, and I think it's important for people to know that, you know, because sometimes people can't fully commit to a plant-based regimen. So I think it's nice to be able to say, well, you know, there are options. So, you know, one of the things that we kind of keep bringing up is phosphorus. And I wanted to talk about, you know, what makes the renal diet, kidney diet different from other diets. And it seems like some of the nutrients that keep popping up are potassium, phosphorus, and sodium. So how, I guess, who wants to jump in on this? I guess what I'm trying to say is, you know, why are these nutrients so important in the renal diet in avoiding them? Am I asking the wrong question, Amy?
No, that's no, it's not the wrong question. When we teach our clients about areas, opportunities, nutrition opportunities that we see, we are looking at areas that are opportunities to preserve kidney function. Okay, if we're talking CKD, we want to slow the progression of the disease, preserve your function. We see some opportunities. Sodium is definitely an opportunity, right? That's a burden on the kidney. It's hard on the cardiovascular system when it's in excess. Not good for your blood pressure. Just extra work for the kidney to clear, you know, to clear that acid load. So the sodium, yes, an opportunity. Phosphorus and potassium, those nutrients, those can become a complication of the disease process. They are not an area where we focus and say, you've got to restrict your potassium to preserve your kidney function, because that's not how that works. That's not the role that they play. They are waste products that the kidney is to excrete. When the kidney's well, those levels stay fine in the blood because the excess is removed in the urine. When that is not happening, then we have to be, you know, careful with the other things that can affect that in the blood. But I think that's where we're trying to kind of clear the muddy waters of, like, again, this renal diet of, when I have patients come to me, or they've Googled it, oh, I can never have that. And
Yeah.
it's usually the stage 5 dialysis, you don't have much kidney function. We're trying to like change that conversation and be like, yeah, sodium, yeah, that's still an area to, you know, help slow the progression. But these other areas, they're very individualized, and there's other things that can impact them, such as constipation can impact your potassium and blood sugars. And so we're trying to look at this a little bit more like bird's eye view, I guess is what you'd say. Does that make sense? Did that answer the question?
Yeah, thank you.
And isn't it the way that I just recently understood was, not even while I was on dialysis, but just that potassium and phosphorus, as far as a dialysis perspective, are larger molecules in general. So it's harder to, I guess, clean them out from treatment. So that's why the focus is so heavy on, I guess, trying to keep those levels down. Just that it takes a lot longer to clean it out of the system if the levels are way, because my phosphorus always ran over 8, like constantly. Like even, I wasn't very diet compliant, but there was a time where I really did try, and it was, my phosphorus level was just higher than most people, I guess. So it was just so hard for me to get those levels down once they started creeping up.
And those things are just harder for our kidneys to process, right? So that's why we have to be careful of the
Yep.
intake. So
We have a question on Facebook.
okay.
Jennifer Lawrence Howley says, how can potassium affect constipation?
Actually, the other way around. So, if you're constipated, so the research shows if you're constipated, you may more like hyperabsorb the potassium. And it's when we look at, like, if someone comes in, their potassium's high, we actually don't go straight to the diet and be like, hey, let's dig into what you're eating. We look at, there's like tons of other things, and constipation is one of them. If you're constipated, you are very likely to, like, not very likely, you have more of a risk factor of having a higher potassium. And so once we get the bowels moving, that can resolve for a lot of people.
I thought it was opposite.
And that's where a
Fascinating.
that's where one of the greatest benefits of the plant-based diet for kidney patients is reducing constipation, because that's what the fiber in the plant foods does. It moves the bowels along. So it's really good. I mean, that's another reason why your potassium may be lower on a plant-based diet. So it's good for the constipation. And a lot of patients do suffer from constipation, and it's miserable. So I always try to add high fiber foods. And those are some of the foods that are sadly so restricted in the old school thinking. So beans, broccoli, kale, whole grains, bran, nuts, and some of the healthy fats too, like even avocado and walnuts, and healthy fats, basically. All that can help with the constipation. So I'm really in favor in helping patients out with that.
We had
since going plant-based, I've had some magnificent bowel movements. So
There you
like
go.
that.
Great.
Get on the plant-based train.
High five.
That's nice. We had a couple of people respond on Facebook how plant-based diets like really helped change the progression or stop the progression of CKD. And I wanted to know how many of you dietitians have experienced that with patients. Have you seen patients turn around, their diagnosis with plant-based diets?
I totally want to stand up and be like, yes, like you just like, it can feel like you're on like this slippery slope down to dialysis. When you get that diagnosis at first, it feels like you're already on dialysis and like you just got the diagnosis. But we see people all the time when you get good, smart nutrition on board, that they turn things around, and they feel so like they feel like they are in control of the disease. And yeah, absolutely, you see that all the time.
Right on.
Wish I would have known that before I went on dialysis.
Right.
Right.
That's why I moved out of dialysis. Is
Yeah.
exactly for that reason. Because I had so many people that like, I just wish I would have known, like if someone would have just told me or given me the choice. And it's so powerful for medical practitioners to give people a choice, right? Like, even if they think, oh, they might not be compliant, or like, that's gonna be too hard, diet's too hard, no one changes, just because maybe they struggle with changing. But like, if they just give people a choice, there are dietary options and it can make a big difference. Let's get you with an expert that can really help make it work for you. It's such a game changer, not just physically, but in like that emotional, mental stance of dealing with a chronic disease. Like, nutrition is empowering.
Yeah,
It is.
I love that.
I would say it's really empowering for CKD patients who have found that they have a diagnosis that they just want to get some control over their life, over what they can eat. They've been given a lot of restrictions, and when they find out that those are not necessarily the best for them, that eating whole foods and a healthy diet and exercise can really, there's actually like a lot of evidence that it does prolong the health of the kidneys. And it makes sense because a lot of people are getting the kidney failure from diabetes and high blood pressure.
Yep.
And healthy diet and exercise directly affect those. So
Yep.
it's just logical. It makes sense, and it's very empowering.
You know, I
You
wanted
heard it,
to,
you heard it here first. Diet and exercise are important for maintaining your health.
you know what I wanted to ask? I love Mexican food, and we have quite a few patients that say, oh, I can't, you know, I'm not able to eat the things that I love, like guacamole or beans and rice. I wanted to know, Mama's Kitchen folk, how do you guys, are there quick fixes for that? Do you have substitutions? What, or do you not even go in that direction?
No, it's not so much quick fixes. We're a little bit creative. We do tacos. We do rice with beans. It's just the portion. So
That's
Lexi
what
and
the
the team of
focus is. Okay.
dietitians. What's that?
Oh, I was just saying, like, that's what the focus is the portion, which is also a very important component of proper diet exercises. Can't eat the big TGI Friday sample.
Yeah, that's such a huge issue with people, Chef Jason, that they always say, well, I can't have this. So, you know, I guess I'm just going to starve. I'm not going to eat anything at all. I've actually had people say that to me. So that's great. I mean, that you bring that up, portion control, right? Everyone?
Right.
Oh,
And
yes.
we're just of the mindset that, you know, we do have vegetarian clients. But I think our organization, it maybe I'm speaking for Lexi here, but we're more of the mindset of just whole foods and whatever that means for each individual.
Yeah, I
So
wanted to talk about that. What's the definition for whole foods?
for me, it's lack of processing. So, you know, the old dietitian slogan of, you know, shopping around the edge of the grocery store, you know, I think that's what it comes down to for us is that's the way we approach our programs, trying to serve whole foods. And then, you know, for obviously people on dialysis, there's some tricks with portion and things like that the dietitians get into.
Mm-hmm.
So
Yeah, exactly. And to add on, one of the concerns that some kidney clients will have is that we do send whole grains because they have been told many times that whole grains are high in phosphorus. And so when they see that we send some brown rice or some farro or oatmeal, they immediately will just say, oh, I can't have that. So it's just a lot of education through the process of our meals, which is why it's great that we as the dietitians get to chat with each of the CKD clients over a course of 3 months, going over educational booklets with them and using our meals as an education piece and talking point. So it's been really helpful to these clients.
That's great. I mean, because that's what it's all about. It's education. We need more of this because so many people are kind of in the dark about all of this. So thank you. So speaking of that, you know, how can people get in the right mindset of switching to a plant-based diet? Have you guys had experience with people that were like, I'm not doing a plant-based diet, you know, and also with that, what's the difference between the plant-based diet and vegan diet? Who would like to answer that? Was that a hard question?
I mean, I could tell you right now, vegan is a lifestyle. It's not just a diet. Vegan means you avoid all animal products. It's more because of ethical reasons. You don't want no harm to come to animals. Even as far as bees, true vegans don't even eat honey.
Right.
And I like honey, so I am not a true vegan. Sorry, vegans. But I do eat plant-based. I eat plants. I do not intentionally go to try to eat animal products like eggs and meat and dairy. I avoid that. And like I mentioned kind of before, I don't go out of my way to avoid fish products because fish products are in a lot of stuff. I actually do take fish oil every day for some omega-3s, get those omega-3s in. But plant-based just means you're eating plants. You're not eating animals.
Is that anyone want to add to that? Jessiana?
Fight me.
So your initial question was like, have we seen people struggle with switching
Yeah.
to that, or like kind of how do you get
Right.
to that point? And certainly we have seen that. I mean, we have patients that come in and the person who's caring for them, often their spouse, is more on board than they are. And so there's like kind of this little push and pull with, you know, they want them to be successful and healthy, and they don't really want to make a change. And for the most part, I think what we have found is that once you can help people release the fear around the disease and feel like what they do matters, then they're okay making the changes that feel right for them. And
Right.
you can't push anybody beyond where they're ready to go. You just got to meet them where they're at, and cheer for them on what you give them information, and then you cheer for them on what they feel like they're going to be most successful. And we have people come in and they are 100% plant-based. First day, they're like ready to go. The fire's on, like they don't have as much. They're either like super scared or have no fear. One of the two things happens there when they're like ready to go. But we have other people who come in and that's not the right place for them. And you don't have to be there. I think you get on like online forums and a lot of patients start kind of getting freaked out. Like I'm not totally plant-based, so maybe that's why my kidneys are failing. Or I'm not doing this, oh, that's why my kidneys are failing. And you get this like on top of fear of disease, you get this like guilt of like, I didn't do enough. It's not enough. I caused my disease. None of that serves you. None of it.
Right.
Only thing
I'm gonna, yeah, sorry. I gotta jump in here.
I love this one.
I gotta jump in here with the mind body piece if I can, Kiku.
Please.
It doesn't serve you. And that's the place where I just feel like we have an opportunity to help, again, guide them, but again, meet them where they're at. Sometimes it's just being plant forward, not entirely plant-based. Like, where could we add some greens? Could you have a smoothie with your breakfast? Like, we're not going to take away your eggs and your toast and whatever, but like, let's just get more comfortable incorporating more plants into your diet. But that mind body piece, when with the fear and the guilt and the shame, which so often we get into operating out of those pain points, that we put our bodies into fight or flight mode, right? And now we're secreting cortisol, and now we're causing problems with the adrenals and blood pressure, and we're releasing inflammatory chemicals into our body. So not only does that not serve you, you know, from a mindset perspective, but now we're just adding fuel to the fire, because kidney disease is an inflammatory condition. So we really want to help alleviate some of that, but we have to guide people and help them where they're at and feel okay with that. And some people are like, I mean, I've had a guy that just did everything I said. And, you know, he's like, if you say it, I'm doing it. I don't care if it tastes terrible. I'll swallow it. I'll do it, you know, like, but that's not everybody. That's not the reality for everybody.
I love that you guys both said meet people where they're at, because you don't want to push something on someone. I mean, especially exactly what you said, you know, because they've just been diagnosed with this, you know, it's a complete change of lifestyle. I mean, Michael, you mentioned, you know, veganism is a lifestyle. Well, you know, the renal diet is also a lifestyle change too for many. So I really appreciate that, what you said.
I love the whole mind body connection thing. That
I like that too.
Totally resonates. And I'm definitely a believer that your mind can have a profound effect over your body. And so if you're feeling bad in your mind, the chances are that your body feels bad are also higher. So
I think it's what I realize is that, you know, when you go into failure and you start, you know, it's a whole process, and having a transplant reject and then having to go back through that process again, you would think like, oh, well, you should, you know, already be accepting that, but it's the same process. You're still in denial, all of that stuff. And so, you know, it's a whole grieving process of this lifestyle that we used to have. And then if you're married or have a part, you know, or whatever, like it's impacting them, it's impacting work, so it's impacting, you know, your whole circle. Ron from Brenner would be proud that I'm bringing that up, but anyway, because he did this whole theory anyway. So it's it's a whole grieving process. So Michael, and to everybody's point, is that mindset of grieving, you know, we're experiencing anger, we're experiencing, you know, loss, we're experiencing just a whole array of emotions behind it. And so it's just very hard to grasp, like, oh, now I can't eat like what I want to eat, you know, that kind of mindset. So so I just applaud everybody, because I think it's just, I'm so excited about this whole concept, that because at least if we could have something that we like to eat, you know, that makes the process a little bit easier.
Yeah.
I think that we can still maybe, you know, engage with, you know, in social activities, have people over to the house, and or whatever, you know, we can still have some type of normalcy.
So are you dietitians finding that the renal diet, well, the plant-based renal diet, is now being accepted in the medical community, or is accepted in the medical community? Have you seen any pushback, or has there been any?
It's hot. It's hot. it is. In fact, it's just a hot topic. Like, that is the push from a lot of places. A lot of the best physicians even are promoting it now.
Yeah.
And so there's something to it. And you know, you just take it one step at a time.
Yeah.
And realize also that a plant-based diet is not also the end all of end alls. It's a really good shift. But if you move towards a plant-based diet and you don't just get a little bit of information on how you gotta be smart, it can have some holes in it that end up tripping people up.
Mm-hmm.
But it is it's really, 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 really big push. It's hot.
Yeah, it's
That's
very,
good to hear.
become really mainstream.
Yeah.
So I think doctors have to pay attention to it. I have, like, in practice, in the clinics, and even like in my own website that I have, doing private counseling, which is small scale, but just patients that wanted to come to a private dietitian. So for help with plant-based, I do have to check with their physicians before I do put them on or help them with plant-based diet, because I do actually get pushback on it because of those perceptions. Many physicians still have that, no, don't eat beans, you know, don't eat nuts, don't have peanut butter, you know, those are still ingrained out in the field, I feel like. So I feel like dietitians who have gotten excited about plant-based education have to do that education with the doctors sometime as well. And I enjoy doing it. So it works. I mean, they do seem to be very accepting of it once they sort of hear your case. So that's my experience.
One thing I think might be helpful, especially for the people who think that they can't do a plant-based diet because they wouldn't be able to eat anything, or it would taste too gross or something like that. And I'm probably going to regret asking this question because I'm hungry right now. I should have eaten dinner before this webinar, because I hear all these nuts and beans. Oh man, make me so hungry. I just want to ask, like, what are your favorite plant-based foods? I'll just start off with mine. Lentils. Lentil soup, lentil loaf. They're so versatile. They're delicious. They're meaty. They're fantastic. And so I want to hear from you guys what you think about what are your favorite plant-based things to eat.
And one of mine is falafels. Yeah, like 100%. We actually put them in our crock pot. They're super easy, like bulk cook them, and that's my favorite.
Right on. How about you, Amy?
Black beans, sweet potato enchilada, black beans in my bowl, my grain bowl, black beans on my salad. You know, in college, we did a research project on replacing fats in brownies, and we used black beans. So
no way.
I don't eat black beans in brownies anymore, but beans are your friend. They're so versatile.
I do want to say that you had a recipe on Kidney Nutrition Institute website, and I posted it on the Balboa Nephrology website for your black bean enchiladas. You guys know what I'm talking about? Those look really good. I want to try those. So
I need to find that now, though.
Yeah.
When she said black bean sweet potato enchilada, my mouth started drooling.
How about you, Celeste? What's your fave?
I like something that a lot of people don't like. I use it all the time. It's tempeh. Does
Oh,
everyone
I
know what
love
that is?
tempeh. Yes.
Fermented soybeans, and I cook it up with nutritional yeast and a little bit of liquid aminos and a lot of garlic. And then I make
Yes.
stir fries with zucchini and kale and all different, whatever veggies are in the fridge, they're going in there. And I have a pressure cooker too that I do a lot of soups and chilies and vegetable stew and that kind of stuff.
Nice.
And I always promote Ezekiel bread to my patients because I'm just a huge fan of that. So yeah, those are some
Yeah,
of my
that's
faves.
very hearty.
Yeah, I'm taking some Ezekiel bread, toast it up, put some peanut butter on there. You're good to
Yes.
go.
Oh yeah, there you go.
The whole meal in
Okay.
itself.
So let me ask you, we're getting down to the time. Sorry, we start talking about food and I just lose my mind. Okay, so so before we end today's webinar, I wanted to ask all of you, what do you hope our viewers will learn from our conversation today? What do you hope they'll take away from this? Chef Jason.
I think for me, I hope that they have the ability to work with a registered dietitian that can look over their blood work and really get them going in the right direction. And then just, what I'm passionate about is getting people to eat whole foods. So
Yeah,
Right on.
that's awesome.
How about you, Lexi?
I just hope that people take away that the kidney diet is very flexible and individualized.
And while I had both of you here, I wanted you to, could you briefly go over once again, how people can be involved with the Mama's Kitchen CKD program?
Yeah, if anyone is interested in the CKD program, you can just go on to the Mama's Kitchen website, which is mamaskitchen.org. We have information about all of our programs on there, referral forms and all of that. So
Thank you.
Awesome.
And Jessiana, I wanted you to also kind of go over what Kidney Nutrition Institute, how people can be involved with your organization as well.
Sure. Yeah. If you go to a bunch of different ways, but you go to kidneynutritioninstitute.org, then you can hop on the blog and grab a bunch of our plant-based recipes. We do all the nutrient facts on them. They're beautiful. I promise we try them out. Not that we don't have missteps, but they're really, really beautiful. They can join our free class that we do twice a month, which is called What Do I Eat? And we can dig into some of the things we talked about tonight, or they can work with one of the dietitians on our team as well. So, and we're just launching like next week our communities that is app and platform based. We do live classes, recipes, meal plans. Like we
Awesome.
really try and make sure people have resources they need so they don't feel confused.
That's great. Thank you. And then also, what would you like people to take away from the conversation today?
100%. I always hope that people feel hope. Like that is always what I hope, that they can feel like this is not like a dead end disease. Because it's not.
Yeah.
It's not. It's just a different path for every person.
Thank you. Amy?
Yeah, what I hope they can take away is that there's so many resources out there, and there is support for you if you decide you want to do this. And it would also say, find someone that'll meet you where you're at and find those resources that are for you. There's lots of plant-based websites and resources, and you can kind of grab a hold of the tone very quickly. And whether it's empowering or more of that guilt and shame, and being the mind, body, nutrition person I am, I just want you to feel empowered and to find a tribe, community, even if it's just a blog that you follow that empowers you to take that next step, whatever that looks like. Not the all or nothing shaming, guilt.
Yeah.
I'm not a fan.
I accidentally watched a TED Talk last night that I thought was going to be a good one about plant-based diets, and it turned into that guilt and shaming, exactly what you're saying. So thank you for that. I was bummed. I had to finish watching it, but yeah. Michael, what would you like people to take away from our conversation today?
3 words and then some other words. Well, I'll talk about the 3 words that I just said. The 3 words are something that my neurologist told me after I had a stroke. Progress, not perfection. Kind of like what everybody's been saying. You don't have to go plant-based right away. Work with your dietitian, like Jason said. Figure out what works for you. And if you think that plant-based is where you want to go, I would say do it slowly. You don't have to go all at once.
Mhm. Thank you. Celeste?
Well, I just want to say that I got really excited about plant-based and vegan diet through actually YouTube. I know this is going to be going on YouTube. There are a lot of really good channels, and I know they don't necessarily cater or tailor to renal diet, but there some of the ones I really like that have amazing recipe prep, meal prep, grocery hauls. I really like Simnett Nutrition. I really like Pick Up Limes. She's a dietitian who does all vegan recipes, and they're amazing. And then some of the other ones, I guess you can just search on YouTube for vegan recipes, and you can even pick a recipe that you liked that has meat in it and try to like tailor it to vegan, and just Google vegan, lasagna or whatever you feel like cooking, or whatever's in the fridge, like a zucchini, like you could just zucchini recipes. And I just really want to make a plug for trying to make a day when you do your grocery shopping and your meal prep, so that you have those items like ready for the week, and also like prepped if you're going to bring lunch to work, or just have like maybe one big pot of something that you make, or one casserole or something that you make for the week, so that you've got it all ready to go and it's delicious and it's going to last you through the week.
Shoot,
I think
wanted
that
to
really
talk about
helps.
that. I wanted to talk about meal prep. Maybe next time we'll definitely have another, this as another conversation.
Plant-based 2,
Yeah.
Yeah, there you
The
go.
Reckoning.
Charmaine, I didn't go to you, did I?
No, it's okay though. I mirror everybody's concern, everybody's takeaways. I think that flexibility, I mean, we're 2022. So things have changed, things have evolved. I mean, I've learned so much just from this hour that we've all been together. I'm so excited about it for people that I talk to that are, going through their kidney journey, and just the flexibility, and just, I always say this, ask questions. Like
Yeah.
it's your journey, it's yours individually.
Yeah.
I mean, I was even way back in the day, like they just saw me coming, because I was just like, okay, I have my notes, and you're going to stay with me until you answer them, because this is my body, it's my health. And so
Nice.
just keep asking those questions. Yeah.
Thank
you guys
Hear,
so
hear.
much. I mean, just beautiful.
Yeah, I want to thank all of our panelists for discussion and for agreeing to participate and help educate folks about a plant-based diet and how it can be beneficial and tasty for patients with chronic kidney disease and end-stage renal disease. And I want to let people know the healthy options, and that a renal diet doesn't have to mean tasteless and boring. So anymore. And I would also like to share, I didn't say it fully, but share my screen. Our next webinar is join us for our discussion on sleep health versus kidney health. And that's going to be on Thursday, September 22nd from 5:30 to 6:30, same time, same place. And then also, I want to thank you. Thank you for watching. And if you or someone you know is dealing with kidney disease and would like to speak to someone who's been on their own kidney journey, please reach out to ReMend. Our website address is remend.org. Reach out on our contact page and see how you can be involved. You can also check out our previous webinars on remend.org or our YouTube channel. So all of us here and our wonderful partners and friends here want you to know that you're not alone. You have resources, and you have people who want to listen and people who care. So if anyone has anything else that they'd like to share.
Just thank you to everyone.
Yeah, thanks so much.
Yeah, thank you guys so much.
Thank you so
Thank
much,
you.
everyone. Thanks for watching.
Never get that right.